Yeast infection is common, for example vaginal yeast infection and oral thrush. Can eating bread cause such fungal infections? Because bread also contains baker's yeast. In reality, baked bread that has killed the yeast inside the dough cannot cause fungal infection. But raw yeast itself can encourage yeast infection in the organism called candidiasis. Baker's yeast in the bread can indirectly affect human immune system negatively. Baker's yeast is one-celled organism from fungus kingdom, which is yeast rising agent during bread baking. Baker's yeast is the same species but a different strain than brewer's yeast. Brewer's yeast is rich with vitamins. Baker's yeast doesn't contain important amount of vitamins and minerals. But it makes bread lighter, softer, and it creates bubbles inside dough. The bubbles represents carbon dioxide, which is created by fermentation of sugars into carbon dioxide gas and ethanol. The carbon dioxide thus produced is responsible for not only increasing the volume of dough, leavening process, through gas incorporation, but also a value addition to the flavor and texture. Yeast also plays a role in the structure formation of gluten and the production of aromatic compounds like alcohols, aldehydes, carbonyls, and esters. Here is the problem, not directly yeast, but gluten. The protein in the bread increases permeability of intestines, which is harmful effect on whole body. An unhealthy gut may open up our body to harmful bacteria, toxins, and undigested pieces of food. Already more than 2,000 years, it is known for humanity that unhealthy gut has correlation with mental abnormalities and disorders like schizophrenia. It is thought that bread can negatively affect intestinal health and consequently general immunity and mental health. On the other hand, some people are overtly allergic to wheat and wheat flour. Minutes to hours after exposure, these individuals develop symptoms such as rashes, headaches, diarrhea, or shortness of breath. It is called baker's asthma. It is the most common occupational asthma. Eating foods that are high on the glycemic index such as bread is associated with an addictive response and increased risk of diabetes mellitus and its complications. Generally, a grain-free diet, although difficult to maintain, especially for those that need it the most, could improve the mental health of many and be a complete cure for others. In addition, there is some evidence that eliminating grains can help lower cholesterol, LDL, not so good cholesterol, and triglyceride levels. When we're talking about grain-free diet, we mean not only wheat and wheat bread products, but all grains including wheat, rice, corn, oats, barley, rye, millet, and spelt.